Nagoya University and Gifu University have jointly launched the program entitled Near-Peer Teaching in Community-Oriented Medical Education based on on-site and virtual learning, integrated with anthropology, NOVI+A. Nagoya and Gifu Universities are a 1-hour ride from each other. Since the establishment of the Tokai National Higher Education and Research System in April 2020, the two universities have been actively promoting partnerships to achieve world-class research competitiveness and regional revitalization. In the field of medical education, both universities take advantage of their respective characteristics. Nagoya University emphasizes research, while Gifu University focuses on community health care. In the 2022-2023 academic year, the two universities connected lectures via the Internet and encouraged their medical students to get connected with each other. They enjoyed heated online discussions on home-based care and reproductive medicine. Both schools are proud of their hard-working students. With the help and support of the faculty and graduates of both schools, the program will help them produce competent physicians who improve the well-being of the local communities in Aichi and Gifu. This program aims to facilitate peer and near-peer assisted learning in community health education. One major feature of this program is the context-based approach of medical anthropology, a branch of humanities and social sciences. Another major feature is virtual education. The former enables students to better understand local health issues as they engage in field outreach, while the latter provides tools that help students communicate and learn without constraints of time and location. For example, students can interact with and learn from physicians who provide medical care in mountain areas that are difficult to reach. In a nutshell, this program provides a synergy of on-site and online modules that foster an anthropological approach to health, illness, and well-being in local communities, while assisting students to learn whenever and wherever they want. We will explain in more detail about medical anthropology, one of the pillars of this program. This discipline was born in North America in the 1980s as a subfield of cultural anthropology. Cultural anthropology investigates the diversity and commonalities of human society and culture through comparison and analysis of various people groups. Cultural anthropology is classically regarded as a cross-cultural discipline. It seeks to understand human behaviors in their socio-cultural context. Likewise, medical anthropology aims to comprehend illness, suffering, and medical practice in terms of the social and cultural context of the people under study. In anthropology, relativism assumes an important role. Anthropologists experience culture shock as they conduct fieldwork in a socio-cultural environment that is different from theirs. For example, they find that the data of normalcy, rightness, masculinity, or femininity should not be taken for granted universally. Anthropologists understand through their cross-cultural experiences that social norms are relative and context-dependent. In an effort to understand the socio-cultural significance of a human behavior or action, medical anthropologists investigate the persons or matters it is meant for. Medical anthropologists observe the object carefully and seek to understand what health, illness, normalcy, and abnormality mean in a given socio-cultural context. While evidence-based medicine aspires to work on and tries to transform their patients or disease based on their highly professionalized knowledge far from laypersons' lives. Anthropologists reconceptualize in a context-dependent manner the ideas that underpin clinical interventions, such as health, illness, normalcy, and abnormality. It is generally held that the goal of medicine is to liberate ill persons from suffering and draw them away from death and closer to health. However, patients may place greater weight on their immediate family responsibilities, pets, life work, or other areas of passion than on their own health and survival. Medical anthropologists evaluate the significance of various components in the patient's life, including health status, expected life expectancy, family, pets, occupational responsibilities, and community festivities, to name a few. By assessing the relative significance of these components in the sociocultural context, medical anthropologists prioritize the matters that mean much to the patient and significant others. The anthropological concept of relativism leads us to evaluate an event according to the internal frame of reference of the community. It encourages us to discuss with the patient and the people around them to determine the matters that are important to them. Medical anthropology addresses the patient, their situation in their life, their daily needs, and their communities. In this regard, medical anthropology has much in common with community medicine. The NOVI+A program provides anthropological fieldwork experiences in the local communities. Through these activities, students will be involved in local health services and interact with community residents in their daily lives. As long as we live, we cannot avoid unpredictable accidents. During field activities, students will encounter unanticipated events and problems that they must learn to overcome by a trial-and-error approach that fits the situation. Field education provides valuable learning opportunities that students cannot find otherwise. Field education also provides an opportunity for students to acknowledge the responsibilities of being a physician through interactions with patients. This program will provide community-based learning under the guidance of faculty members specializing in cultural and medical anthropology. As explicitly stated in the Model Core Curriculum for Medical Education, the integration of a medical anthropological approach in medical education is expected to have a significant impact on community medicine and the quality of medical education of both universities. Next, we move to the second pillar of the NOVI+A program, virtual learning. We are enriching a web-accessible database system that helps students and future attending physicians learn efficiently wherever they may be. Specifically, we will use the e-portfolio system for interactive communications between the faculty and students. We will also create on-demand learning materials for medical students and doctors under training to become attending specializing in community medicine. The ePortfolio system serves as the information hub of the NOVI+A program. It archives all fieldwork data collected by the students and community physicians involved in the program. It provides access to users whenever and wherever they need it. A series of on-demand materials is being developed by collaboration of faculty members and community physicians. These materials deal with family medicine, emergency medicine, and infectious diseases. These areas of medical service will be in great demand in the Tokai region in the future. The on-demand materials will be regularly updated to provide the latest contents to the users anytime and anywhere. The help from physicians practicing in Aichi and Gifu prefectures is an asset that provides region-specific trends in their specialties. In addition to on-site education, this program provides virtual education. A typical example of virtual education is remote learning using a holographic computer device. This mixed reality headset enables teaching of clinical skills effectively in a distance learning setting. It helps students and physicians in a supervisory arrangement receive remote instructions and guidance from the attending physician. The device can also display virtual materials and other objects in the visual field to assist the user. It is yet another objective of the NOVI+A program to provide a virtual learning environment for faculty development. Physicians practicing in the local communities are often too busy or too far to participate in required on-site faculty development programs. To overcome these physical constraints, we provide online programs that help physicians to develop teaching expertise in the community settings. The NOVI+A program offers a variety of educational activities covering first-year to sixth-year students. These educational activities are co-sponsored by Nagoya University and Gifu University, building upon their partnerships through the Tokai National Higher Education and Research System. The collaborations for community medicine between the two universities will activate the networking interactions between their faculty, staff, and students, which will make a great impact on their research and education. To illustrate this program's educational activities, we show the use of wearable smart glasses, Google Glass, in a practice session for fifth-year students. In this session, students learn clinical skills and competencies in home visit care by attending a real-world clinical setting. Although the significance of interprofessional collaboration cannot be overemphasized, physicians are often unaware of the concerns and perspectives of other professionals who collaborate with them. Moreover, physicians may not fully recognize the experiences and perspectives of the patients and their relatives. In this practice session, the physician, nurse, pharmacist, medical clerk, patient, relatives, and students each put on wearable smart glasses to record video from their line of sight. In addition, a wide-angle camera is set to document the entire consultation session from a broader range. After the visit, students review the footage recorded on individual devices as their users account for their actions. Students discuss with other participants about the similarities and differences in their thoughts and perspectives. By reliving and reviewing the clinical session, medical students can have an in-depth learning experience that helps them develop an interprofessional mindset and foster interest in the overall well-being and quality of life of the patient and their relatives. This program owes much to the help of community residents, local medical professionals, government officials, university staff members, and many more. We aim to nurture a generation of professionals devoted to community medical care in Aichi and Gifu prefectures. We cordially ask for your continued support and cooperation. Thank you.